Assalamu alaikum class. I hope you all are fine. So continuing with the infections of the gastrointestinal tract, our topic of discussion today is cholera. Now, as you know, cholera is a acute diarrheal disease, and in some of the cases there can be symptoms, and in some cases it can be asymptomatic as well. Now, the typical cases are characterized by the sudden onset of profuse watery diarrhea, which can be effortless, followed by vomiting, and there is rapid dehydration, muscular cramps, and suppression of urine. So unless there is rapid replacement of fluid and electrolytes, the fertility may be high as 30 to 40% of the cases. As you all know that cholera is an acute diarrheal disease, and the cases should be reported to WHO. Now, it is caused by basically two serogroups, the Vibrio cholera 01 and 0139, and these are the two which cause the major outbreaks. But the cholera transmission is basically closely related to the inadequate environmental management, and typically the risk areas where cholera transmission can occur and can lead to an epidemic are the peri-urban slums, or the slums where the basic infrastructure is not available, or the infrastructure has been destroyed due to a disaster, or there has been disruption of the water and the sanitation system. So there can be displacement of population, which can lead to overcrowded camps and such areas. So in these areas the transmission of cholera is more. Now, cholera is both an epidemic and endemic disease, and it depends on the characteristic of the agent and the characteristic of the environment which is available to that agent. Now, the characteristic of the agent which influence its distribution includes its ability to survive in a given environment, are that the virulence of the agent and the number of organisms which are required to cause an infection. So these are the basic characteristics of the agent which can influence the transmission of the disease, and which can lead to epidemic. Now, the characteristics of the system or the environment which affect the distribution of the causative agent include the number of the susceptible contacts and the opportunities it provides for the transmission of the infection. Now, as I told you, the epidemics of cholera can occur, and it can in some areas it's an endemic disease as well. Now, the epidemic of cholera are characteristically abrupt, and there is a sudden onset of the disease and can lead to an acute public health problem. Now, they have a high potential to spread fast and can be fatal as well, and the epidemic reaches a peak and subsides gradually as the force of infection declines. Now, the force of infection is composed of two components, that is the force of infection through water and the force of infection through contacts. Like if we eliminate or we stop the consumption of contaminated water, it does not mean that immediately all the cases or the outbreak will end abruptly, but so-called a tail of epidemic is produced. This is due to the continuation of the transmission through the contacts who have already consumed that contaminated water. Now, in areas where cholera is considered as an endemic, it does not show susceptible endemicity like other diseases like typhoid fever. It undergoes seasonal fluctuations, like in some areas like in Bangladesh, it is usually endemic in the early winters, or in some areas in summers as well. So it is endemic in certain areas as well. Now coming to the epidemiological determinants. Now the organism that causes cholera is the Vibrio cholera O group 1 or the Vibrio cholera 01 and O139, and usually it is therefore it is necessary to identify the Vibrio cholera 01 and 0139 for the specific diagnosis of cholera. Now within the 0 group 1 2 biotypes, that is the classical and the Altor type, are present, and they should be differentiated. Now coming to the resistance. Now the Vibrio cholera are killed within 30 minutes when heated at 56 degrees centigrade, or if we boil the water, within few seconds the Vibrio cholera are killed. Now they can remain in ice for 4 to 6 weeks or longer, and drying and sunshine will kill them in a few hours, and they are easily destroyed by coal tar disinfectants such cresol, and bleaching powder is also a good disinfectant. Now the toxin production by the Vibrio is that the Vibrio multiplies in the lumen of the small intestines and produces an exotoxin or an enterotoxin. Now this toxin produces diarrhea through its effect on the adenylate cyclase cyclic AMP system of the mucosal cells of the small intestines. Now coming to the reservoir of infection. Now the human being is the only reservoir of cholera infection, and human being can be a case or the carrier. Now the cases, they range from inapparent to severe ones, and the carriers are usually temporarily, and rarely they can be chronic carriers. And the carriers are usually are important contribute to the reservoir of infection, since carriers are detected by the bacteriological examination of the purge stool, and which induced by the administration of 30 to 60 grams of magnesium sulfate in 100 ml of water by mouth. Now next, continuing the epidemiological determinants of cholera is the infective material. Now the infective material is the stools and vomit of the cases and carriers who have cholera. Now the large number of Vibrios, that is 10 to raise power 7 and 10 to the power 9 Vibrios per ml of fluid are present in the watery stools of the cholera patient, and an average patient excretes about 10 to 20 liters of fluid. Now the cases, mostly about 75% of the people with Vibrio cholera, they do not develop any symptoms, although the bacteria is present in their feces for 7 to 14 days after infection, and they shed back into the environment and are infecting the other people who are coming in contact with with those feces or that feces infected water. Now next are the carriers. Now the carriers, they excrete fewer vibrios than cases, that is 10 to the power 9 till 10 to the power 5 vibrios per grams of stools. Now the infective dose of cholera is dose related. Now the infection occurs when the number of vibrios ingested that exceeds the dose that is infected for the individual. And now research suggests that in the normal person, a very high dose, sometimes like 10 to the power 11 organisms, is required to produce the clinical disease or to produce some signs and symptoms. Now the period of communicability is that the case of cholera is infective for a period of 7 to 10 days, and the convalescent carriers are infectious for 2 to 3 weeks. Now the chronic carrier state may last from months up to 10 years or even more than that. Now, next are the carriers in cholera. Now, the cholera carrier is a person who is apparently healthy looking but is excreting Vibrio cholera classical or the Eltor in stools. Now, the four types of cholera carriers are present. Number one is the preclinical or the incubatory carrier. Now, in the incubation period of cholera is very short, that is few hours up to 5 days, but commonly it is 1 to 2 days. Now, the incubatory carriage of this disease is of very short duration. So, the incubatory carriers are the potential patients who can cause the disease. Now, next are your convalescent carriers or the carriers who shed the disease during the period of recovery or the convalescence. Now, the patients who have recovered from the cholera may continue to excrete vibrios during the period for 2 to 3 weeks. And the convalescent state has been found to occur in patients who have not received effective antibiotic treatment. Now, the convalescent carriers can often become chronic or the long-term carriers. Now, next are your contact or the healthy carriers. Now, the healthy carriers, they occur as the result of the subclinical infection, which is contracted through association with the source of infection, which can be a case, or through infective environment. Now, the duration of the contact carrier state is less than 10 days, and the gall bladder is usually not infective in this case, but the stool culture is frequently positive for Vibrio cholera O1. Now, the contact carriers basically play an important role in the spread of cholera in a community. Now, next are your chronic carriers. Now, the chronic carrier state occurs very rarely, very less, and the longest carrier state was found to be over 10 years of age. 10 years. Now, the studies indicate that the gallbladder is infective with Vibrio cholera in chronic carriers. Now, after the agent factors, we come to the host factors. The incidence of this disease is highest in the lower socioeconomic group, and this is mainly attributed to the poor hygiene in that group. Cholera affects all the ages and both sexes, and in endemic areas, the attack rate is highest in the children. Now, in the areas where there is movement of population, like during pilgrimages or like in fairs and festivals, now the movement of population results in the increased risk of the exposure of infection from one area to another area, as the cases and carriers can easily transfer the disease from one community to the other community. Now, gastric acidity is an effective barrier, and Vibrio is destroyed in an acidity of pH of 5 or less. Now, coming to the environmental factors, as I told you that it is the disease which occurs in the lower socioeconomic group, and in that group there is lack of personal hygiene, lack of education, poor standard of living, and poor quality of life, and this leads to water and soil pollution, and this further causes poor environmental sanitation. So, the environmental factors of importance are contaminated water and food. Now, the mode of transmission is mostly the fecal contaminated water with Vibrio cholera, and the food which is contaminated with Vibrio cholera. It can also spread with the direct contact of a person who has this disease to another person, and this is usually transmitted through contaminated fingers. Now, incubation period is, I told you before, it is from a few hours up to 5 days, but commonly between 1 to 2 days. Coming to the pathogenesis of the disease, now as I told you that the main symptom of cholera is diarrhea, according to the new concept, it is said that it usually secretes mucinase, with which it is attached to the intestinal epithelium as it passes through the mucus. Now, when it is adhered to the intestinal the epithelial cell, it is probably done by an adherent factor which is attached on the surface of the bacterium. Now, when the Vibrio becomes adhered to the mucosa, it produces an enterotoxin which consists of two parts, the L toxin and the H toxin. Now, the H toxin, it combines through gangliosides in the epithelial cell membranes, and this binds the Vibrio to the cell wall of the cell. Now, this binding is irreversible. Now, the mechanism of action of H toxin is not yet fully clear, but it is said that there is a substance in intestinal epithelium, that is the adenyl cyclase, and the H toxin activates this substance, and when this substance is activated, it causes a rise in cyclic AMP, which is your 3,5-adenosine monophosphate. And the cyclic AMP provides energy which drives the fluids and ions into the lumen of the intestine, as this fluid is isotonic and it is secreted by all the segments of the small intestine. So the increase in the fluid is the cause of diarrhea, and this is how the mechanism of action of this bacteria is. Now, coming to the clinical features, now the severity of this disease depends on the rapidity and the duration of the fluid loss. Now, studies have shown that mostly that the 90% of the LTOR cholera cases are mild and usually are clinically indistinguishable from other acute diarrhea. However, a typical case of cholera consists of three stages. Number one is your stage of evacuation, that there is onset of abrupt diarrhea, and which is profuse and painless watery diarrhea, and there is passage of rice water stools, and a patient may pass as many as 40 stools in a day. Now, after the stage of evacuation, in which there is fluid loss, the stage of collapse occurs, and as the patient is passing too much fluid, the patient gets dehydrated. In dehydration, you know that the pulse becomes weak, the BP can drop, and it can become unrecordable, and there can be sunken eyes and hollow cheeks, and the respiration becomes quick, so the output of urine also decreases. So death may occur at this stage if not treated properly, that we do not treat the dehydration and acidosis properly. Now, when this is done, then the stage of recovery starts, and the patient shows signs of clinical improvement. Now, coming to the diagnosis of cholera. Now, the diagnosis of cholera cannot be made entirely on clinical grounds. Lab investigation and lab diagnosis is very important for the confirmation. Now, first of all, the stool samples are collected there, and a fresh specimen of stool should be collected for lab examination. Now, the sample should be collected before the antibiotic treatment is started, and the collection can be made either by introduction of rubber catheter into the rectum, and with the help of this catheter, the specimen is collected into a transport medium, which is the VR medium and the alkaline peptone water. Or the stool sample can be collected with the help of a rectal swab, and then it is transported to the lab. Now, the water which is contaminated with Vibrio cholera is also collected in sterile bottles, and 1 to 3 liters of the suspected water should be collected in the sterile bottles, and then should be transported to the labs. Same is the case with the food samples in which it is suspected that Vibrio cholera are present. They should also be collected in sterile bottles, and they should be transported to the labs. Now, for transportation, it's important that, as I told you before, sterile bottles should be used, and that should be transported to the labs. Now, in the lab, direct examination can be done with dark field illumination if it's available. It may be possible to diagnose about 80% of the cases within a few minutes, as in dark field, the Vibrio cholera look like the image of many shooting stars against a dark sky. Now, if the mobility ceases on mixing with polyvalent cholera diagnostic serum, the organisms are presumed to be Vibrio cholera. Now, after that, the specimens are further used for other methods, and the culture methods are used. Now, when the specimen is taken, the specimen is well shaken, and about 0.5 to 1 ml of the material is inoculated into the peptone water telluride medium for enrichment. And after overnight incubation, the plates are screened under oblique light illumination for Vibrio colonies. Now, the Vibrio cholera usually appears on bile salt agar as moist, raised, smooth, translucent, and easily emulsifiable colonies about 1 millimeter in diameter, and the gram negative and curved shade rods are characteristic of Vibrio cholera, and showing scintillating type of movement in hanging drop preparations are very characteristic of Vibrio cholera. Further serological tests are done, and biochemical tests are done to further confirm the diagnosis. This is how lab diagnosis of the specimen of cholera is done. The control of cholera in our country, it's important to develop and implement a national program for the control of all diarrheal diseases, because there are similarities in the epidemiology, the pathophysiology, treatment, and control of cholera and other acute diarrheal diseases. Now, there are certain guidelines which are given by WHO for the control of uh, cholera in a country. Now, the guidelines are: number one is the verification of the diagnosis. It is very important to confirm the outbreak of an epidemic of cholera as quickly as possible. Now, all cases of diarrhea should be investigated properly, even if there is a slight suspicion. For the specific diagnosis of cholera, it's important that we identify Vibrio cholera O1 in the stool of the patient. So, verification of diagnosis is very important. Next is notification. As I told you before, that it is a notifiable disease locally as well as nationally, and under the international health regulations, cholera is notifiable to WHO within 24 hours of its occurrence by the government. Now, the number of cases and deaths should be reported daily and weekly till the area is declared free of cholera. Now, an area is declared free of cholera when twice the incubation period, that is 10 days, have passed since there is any death due to cholera, or recovery or isolation of the last case. Now, next is the early case finding. As you know, as I told you before, that cholera cases, there is abrupt onset of diarrhea, and the spread is very quick, and the incubation period is very short. So, an aggressive search for the cases should be made in a community, so that prompt treatment should be started, and early detection of the cases is very important for that. Next is the establishment of the treatment centers. Now, for the control of cholera, no time should be lost in providing treatment to the patient. So, in mildly dehydrated patients, which usually occur over 90% of the cases, they should be treated at home with the oral rehydration therapy or the oral rehydration fluid. Now, in the severely dehydrated patient who require intravenous fluid, they should be transferred to the nearby health facility, hospitals or dispensaries, so that the prompt treatment should be started. Next is the rehydration therapy. Now, cholera is now the most effectively treated disease with the help of the rehydration therapy, and because of this, the mortality rate has also declined to less than 1% by effective rehydration therapy. Now, the rehydration therapy, it can be in the form of oral therapy or it can be intravenous. I'm not going to go into the details of the rehydration therapy, as you will study in detail in the treatment of the acute diarrheal diseases. Next is the adjuncts to therapy. Now, along with the rehydration therapy, antibiotics should be given as soon as the vomiting has stopped, that is usually after 3 to 4 hours of the rehydration therapy. The commonly used antibiotics are your fluoroquinolones, tetracyclines, azithromycin, or trimethoprim sulfamethoxazole or ampicillin. Now, no other medication other than these antibiotics should be given, like antidiarrheals or antiemetics. They should not be given with the antibiotics. Now, next is your epidemiological investigation. Now, for the control of cholera, it is important that you see what is the extent of the outbreak or what is the extent of the epidemic, and we should identify the modes of transmission so that more effective and specific control measures should be carried out. And the epidemiologist, he must maintain and contact all the health facility in that area so that new cases of the disease can be identified. Now, next are your sanitation measures. Now, sanitation measures are very important. Number one is to provide safe water to the community. As you know, water is the most important vehicle of transmission of cholera. So all steps must be taken to provide properly treated or safe water to the community for all purposes, like for drinking purposes, for washing and cooking. So for that, chlorination of the water is very important, and chlorination of water should be carried out at the all the areas where the water is stored, and proper provision of piped water supply on a permanent basis should be carried out. Next is important in the sanitation measures is your excreta disposal. So proper disposal of the excreta should be carried out, as it can be a cause of spread of diarrheal diseases. And health education messages should be stressed, especially in the low socioeconomic group, as they are the basic group which should be targeted. Next is your food sanitation. Now, food may be an important vehicle of infection, so steps should be taken to improve the food sanitation, especially the sales of food under hygienic condition. And the health education must be stressed, so that the importance of eating cooked hot food and of proper individual food handling techniques should be emphasized. Now, continuing with the sanitation measures after proper disposal of the excreta and food sanitation and safe water supply, next is the disinfection. Now, the disinfection should both be concurrent and terminal, and the most effective disinfectant is cresol, which is a coal tar disinfectant. If cresol is not available, good quality bleaching powder should also be used, and all the patient's belongings, like all the linen and all the clothes and the contaminated other things, along with patient stool and vomitus, should be properly disinfected, so that the other people are safe from the effects of this disease. Next is your chemoprophylaxis. Now, studies have shown that approximately 10 to 12% of the close household contacts may be bacteriologically positive, and some of them may develop clinical illness. Now, for chemoprophylaxis, tetracycline is the drug of choice, and it has to be given over a period of 3 days. In a BD dose, that is twice daily dose of 500 milligram for adults, 125 milligram for children which are of the age 4 to 13 years, and 50 milligram for children who are aged 0 to 3 years. Alternatively, the long-term acting tetracycline, that is doxycycline, may be used for chemoprophylaxis if the strains are not resistant. In doxycycline, a single oral dose, that is 300 milligram for adults and 6 milligram per kg body weight for children under 15 years, have been proved to be effective. Now, next guidelines according to WHO are the vaccination. Now, oral vaccine is given for cholera, and there were two vaccines, which was duck oral and Sancol, but now since 2015 another vaccine has been added, and all these three are oral vaccines. Now, duck oral is a monovalent vaccine which is based on formalin and heat-killed whole cells of Vibrio cholera O1, both classical Altor, Inaba and Agava type, and plus a recombinant cholera toxin B subunit is used. Now, the vaccine is provided in 3 ml single-dose vials together with a bicarbonate buffer. Next is your schedule of this vaccine. Now, according to the WHO, the primary immunization consists of 2 oral doses, which are given more than or equivalent to 7 days apart, but the time period should be less than 6 weeks apart for adults and for the children aged more than 6 years. Now, the children who are aged 2 to 5 years should receive 3 doses, and that is more than or up to 7 days apart, but the period should be less than 6 weeks apart. And intake of food and drink should be avoided for 1 hour before and after the vaccination of the person. Now, if the interval between the primary immunization is delayed for more than 6 weeks, then the whole procedure of immunization should be restarted. And protection may be expected about 1 week after the last scheduled dose. Now, provided there is a continued risk of Vibrio cholera, one booster dose is recommended by the manufacturer after 2 years interval for adults and children who are above 6 years of age. Now, duck oral is not licensed for children who are aged less than 2 years of age. Next is your Sancol and MOR-CVAX. This is another vaccine, but this is a bivalent oral vaccine, and it does not contain bacterial toxin B, so therefore buffer is not required along with this vaccine. This is also an oral vaccine. It is given in 2 liquid doses 14 days apart for the individual aged more than 1 year, and a booster is recommended after 2 years of age. Now, UV Col is the third type of oral vaccine, which I have told you has started it since December 2015, and the characteristics of this vaccine are almost similar as those of Sancol. Now, according to the guidelines, the next most effective prophylactic measure in the control of cholera is the health education. As I told you that this is the disease of the basically the low socioeconomic group in which there is lack of education, they have a poor standard of living, poor quality of living, their hygiene is not good, and there is very less hand washing after defecation and before eating, and they don't know the benefits of cooked hot food and save water, and they are not very well aware of the oral rehydration therapy. So health education, which is most effective and most cost effective as well, this group should be targeted for all these things, and health education should be provided to them for the control of cholera. Now, with this, we finish cholera. If you have any questions regarding this lecture, you are most welcome to ask in the comment section. Thank you.